Welcome to More Than Words, a podcast about treating the whole child brought to you by the Reading and Language Learning Center. I'm your host, Tristan, and today I'm joined by speech language pathologist and owner of KCB Play Institute, Dr. Lauren Buford, to discuss co-treatment between speech and occupational therapy. Well, hi, Dr. Buford. How are you?
I'm doing extremely well today. How are you doing?
Awesome. We're really excited for you to be here. I think this is a topic that some parents know but don't fully understand, and then some people just don't know at all. So I think this is going to be a great discussion today.
Absolutely.
Yeah. Well, let's start with an introduction. So tell us a little bit about who you are and what you do.
My name is Dr. Lauren Buford. I'm the president and CEO at the KCB Play Institute, where we specialize in pediatric speech and occupational therapy. I'm a speech language pathologist, but most importantly, I'm someone who believes deeply in the power of family-centered care. Because when therapy honors each child's unique strengths and the wisdom of their caregivers, remarkable things happen. My journey began many years ago with a little girl who couldn't yet speak, but had so much to say. With trust and connection, she blossomed, and so did my calling. Today, I work alongside incredible families to support neurodivergent children in building confidence, regulation, and joyful ways to connect. Our mission is simple: meet each child where they are, celebrate who they are, and help them grow in ways that feel authentic and empowering.
Mm. Oh, that is so wonderful. I think a lot of people can relate to that feeling of having someone who can't yet speak but has a lot to say, and the fact
Yes,
that you're able to, make that happen for people is so special.
absolutely.
Yeah. So you are, like you said, president, owner, CEO of KCB Play Institute. So if
Yeah.
people were gonna come find you guys, where are you in the world? But then also, how would they contact you?
Absolutely. So you can find me in person at the KCB Play Institute, located at 8348 Trafford Lane, and you spell Trafford Traford, Suite 200 in West Springfield, Virginia. And if
Okay.
you prefer to connect online, I'm just one click away. You can find me on Instagram at Dr. Talkback. So that's Dr. period Talkback. And you can learn more about our work at kcbplayinstitute.com. Or you can check out my personal website at laurenashleybuford.com. Whether you're curious, looking for support, or just want to say hi, I'm always glad to connect.
Awesome. Well, then I'll link all your stuff in the show notes so people can find
Yay.
you. So you've got Instagram, and then you've got the kcbplayinstitute.com website, and you have your own personal website. So all three
Yes,
of those
ma'am.
spots for online. So perfect.
Absolutely. Yeah.
Awesome. Well, let's hop into this discussion here. So we're
Mhm.
talking about co-treatment, and can you just define for us what that is?
Yes. So let's dive into what it really means when therapists team up.
Yeah.
Sometimes the most meaningful support for a child doesn't come from one specialist working alone. It comes from collaboration. That's the magic of co treatment. It's
Right.
when professionals from different disciplines, like a speech language pathologist and an occupational therapist, work side by side in the same session. Instead of two separate appointments, the child gets a dynamic, integrated experience where communication, movement, and regulation come together in real time. You'll most often see this in sessions combining occupational therapy, speech language pathology, physical therapy, or sometimes music therapy. And while less common, ABA therapists may also collaborate, especially when supporting autistic children. You may be wondering about the goal of co treatment. When done intentionally, co treatment blends expertise in a way that's engaging, efficient, and uniquely tailored to the child's strength. For example, while a speech language pathologist helps a child understand and use concepts like under or above, an occupational therapist may be guiding movement activities that reinforce those words through physical play. Or during a shared session with a physical therapist and occupational therapist, the physical therapist might lead balanced exercises while an occupational therapist focuses on routines like brushing teeth or getting dressed, building both motor skills and daily independence. It's not just about multitasking, it's about creating moments where language, movement, and life skills connect in meaningful, child centered ways.
Wow, that is really cool when you really sit down to think about it, because
Yes.
you get, like you said, all of the connection, and it feels kind of like this sounds silly, but like when you're in school and you get like a word problem or something where you like have to actually put like in context, right? Like in a way that
Yes,
actually makes sense.
absolutely.
That's really cool.
Yes, absolutely. It's absolutely dynamic to just see it actually play out and how helpful it is for the child that we're
Right.
helping. Yes.
Yeah. I can only imagine. I mean, the amount of help that that provides to a child
Hmm.
who is especially having like a hard time conceptualizing things, I feel like
Yes,
it's such a good way to get the speech and like you said, the motor skills kind of like lined up in their body.
absolutely. It just seems like with a co-treatment, things just kind of click. They go
Yeah.
hand in hand. Yeah.
Wow. That's really cool. So when
Mhm.
you do a co-treatment session, like, do the providers have to come from the same company or what happens there most of
Good
the time?
question. Good question. So, no, co treatments across different practices is certainly possible, but it's less common than when providers work under the same roof. And it's largely due to logistics, not a lack of interest.
Right.
Speech language pathologists, occupational therapists, and ABA providers often want to collaborate, especially when they share goals for a child. But when they're employed by separate clinics or agencies, co treatments become a bit more complex. You may be pondering why it's less common. Some common reasons include, for instance, scheduling struggles, different
Mm.
calendars, different settings, and different service models. The fact that we don't share systems. Each practice
Right.
usually uses its own documentation tools, so exchanging notes and coordinating care takes extra effort. Privacy protections. Providers
Mm,
need signed release of information forms to legally communicate with one another. And
right.
the big one, insurance barriers. Some
Mm,
insurers won't cover two services delivered at the same time, especially if the providers are billing separately. Even if it's clinically appropriate, families might end up paying out of pocket for one of the disciplines. And then
right.
lastly, administrative constraints. Practices may have internal policies that limit coordination outside their organization or don't
Right.
reimburse therapists for time spent planning joint sessions. That said, when it does happen, it's often driven by parents who advocate for cross disciplinary collaboration. A parent
Right.
might request a joint session to target a shared goal, like communication during movement play, or ask providers to consult and coordinate care, even if they don't share physical space. Providers
Right.
may also schedule occasional co treatment as a short term strategy rather than a standing weekly plan. So, while co
Mm,
treatment between separate practices isn't the norm, it's absolutely doable with some
right.
upfront planning. If this kind of collaboration could benefit your child, do not hesitate to bring it up at your next session. It actually might be a really powerful conversation.
Yeah, it sounds like it. And I think sometimes there are parents who are especially like either new to the journey or they're really seeing like, I know my kid can do X, Y, Z, and they're just having a hard time with it. They're really like ready to advocate for their kids.
Right.
Um, and like this is a good thing to like be reminded of. Like sometimes you just have to really like say, I need this XYZ to happen for them. Um,
Absolutely.
yeah. So if a parent is, let's say, like not trying to convince someone that they need a co-treatment session, but like let's just say they're advocating for their kid, what are the benefits of co-treatment that they could maybe share with either their insurance company or provider or someone to kind of remind them like this is why we need this and this is why it would be the best use of everyone's time and resources.
I love that question. So the upsides are pretty remarkable, especially for kids who benefit from a whole child approach. Co-treatment means we can tackle multiple goals in one session: speech, sensory regulation, motor skills, without overwhelming the child. Instead of
Right.
two back-to-back appointments, therapy is integrated, coordinated, and often more playful. Collaboration between therapists is huge. When two disciplines come together in the same space, we're not just sharing notes, we're actively problem solving in real time. We can
Right.
spot what's working, what needs adjusting, and shape a plan that reflects a child's unique strengths and challenges. It's the kind of teamwork that leads to faster, more meaningful progress. When it comes to neurodivergent kids, especially autistic kiddos, co-treatment can be transformative. Many autistic children find sensory activities more engaging than purely
Mm.
language-based tasks. So when an OT brings in movement or sensory tools and the speech therapist folds in communication targets right there, we're meeting the child where they are most motivated. Instead of making them sit through two separate sessions, we create an experience that feels natural and connected. Co-treatment also helps with generalizing skills. One of the biggest benefits is that kids just don't learn the skill in isolation. They learn to use language while moving, to regulate emotion while playing, and to communicate during social routines. All of it is woven together, and that kind of integration transforms beautifully to the real world, school, home, and at the playground. Co-treatment is not just efficient, it's effective. It's about creating
Yeah.
therapy that feels lifelike, not just like a checklist. When done thoughtfully, co-treatment helps your child grow in many ways that are coordinated, meaningful, and true to how kids naturally learn.
Wow. Who is the appropriate person for co-treatment? Like what I think you mentioned like a lot of kids with autism often benefit from
Yes,
co-treatment, but like who are the other folks?
yes, absolutely. So co-treatment really shines when a child's needs cross into both speech and motor or sensory domains.
Okay.
In these setups, therapists blend strategies. So I want you to think about younger kids or those with shorter attention spans who need
Yeah.
fast paced, sensory rich sessions. Children already seeing two disciplines, speech plus OT or PT or behavioral support where goals overlap. Kids who benefit from sensory regulation, like deep pressure or movement breaks alongside communication targets. These are some official guidelines to keep in mind while considering co treatment. The American Speech Language Hearing Association, the Occupational Therapy Association, and the Physical Therapy Association agree on a few key points. Co treatment is driven by clinical benefits, not just scheduling convenience. Only
Right.
two disciplines should team up in a single session, so no more than two
Mm.
therapists at once. Documentation must clearly state why co-treat is chosen and list the shared goals. Also, each therapist records which goals were addressed and the child's progress. Please note, co-treatment isn't a one size fits all. Older
Right.
children who can focus for a full hour without sensory support, or kids whose goals focus strictly on speech or strictly on fine motor skills, often advance faster with dedicated single discipline sessions.
Mm.
Lastly, some takeaways for parents. Before booking back to back appointments, parents may consider having a conversation with their child's therapy team about co treatments. I encourage parents to reflect on questions like: do my child's goals genuinely overlap across two disciplines? Will
Mhm.
combined strategies help my child regulate and communicate more effectively? And can we limit sessions to two therapists and establish clear shared objectives? When done thoughtfully, co treatment can turbocharge progress, making therapy feel like play and doubling the benefit of every minute.
Wow. So if you had, like you said, if you had like an older kid who could benefit from, or who could sit through like an hour long session, like two of them,
Hmm.
that would be someone who maybe, um, what isolated sessions would do better for them. Um,
Yes.
but you're saying more like any of the younger kiddos or kids who have like truly overlapping goals, those are the ones that would be most appropriate for co-treatment, right?
Absolutely.
Okay.
And those kiddos with shorter attention spans, those
Oh
kiddos
yeah.
that are on the spectrum, co
Right.
treatments work beautifully for them.
Yeah. And I think you had mentioned earlier, but like sometimes occupational and physical therapy happen at the same time too.
Yes.
Okay.
Yes, that can happen as well. And that's a
Okay.
beautiful merge, just like speech and OT. And speech
Right.
and PT can happen at the same time
Oh
as
yeah.
well, too. Yes.
Okay. Very cool.
Yes, ma'am.
So when you've set this co-treatment session up, right? Like two
Hmm.
disciplines have come together, and since we had between our practice and yours, we're talking more speech and OT.
Hmm.
Um, can you give us an example of like what that session might actually look like?
Absolutely. So, a
Yeah.
co treatment session between speech language pathology and occupational therapy, for instance, is all about collaboration and maximizing engagement. So, it
Right.
often involves targeting overlapping goals, like I stated, like memory, motor planning, and attention in
Oh,
ways that
yeah.
feel really playful and purposeful for the child. For
Right.
example, we might build an obstacle course to work on sequencing and gross motor skills while also reinforcing language by having the child recall and describe each step. Or
Mm,
we might combine fine motor tasks like handwriting with articulation practice, helping the child connect the sound and shape of each letter. For children with shorter attention spans, especially with those who are on the spectrum or who have ADHD, we often alternate between speech and OT led activities every few minutes. That rhythm keeps things exciting and allows us to tailor the session to their energy and focus, which really boosts learning and retention. And the magic really happens when both disciplines bring their lens and we create a flow that's truly centered on the child's strengths and needs. Because when therapies come together, our kids are, like I stated before, they get the support they need in ways
yeah.
that they feel are engaging, affirming, and are built just for them. So it's customizable, essentially.
Right. That is really cool. It sounds like very fresh, very fun. Um,
Yes,
I loved the obstacle course. I think I've
it's
like,
my favorite.
yeah, I think I've
Yeah.
seen it before, but like not in person. I've just like seen, on if you go on like any OT's website, like I feel like I've seen the little obstacle course, but I didn't even think about that being blended with speech. Like, what
Yes.
a great method.
Absolutely. It's phenomenal to see it actually play out and how speech no longer just becomes kind of like just a task where we're sitting at a desk. We are
Right.
moving and grooving and getting speech done all at the same time. And it seems to be really, really fun for the kiddos.
Wow, how cool. And it's kind of like you feel like you're just playing as the kid. You don't necessarily
Exactly.
realize how much like work you're getting done and how much you're exercising your brain as well as like your physical body.
Exactly. Yeah,
Yeah.
like you said, they don't even realize they're getting work done. It just seems like we're just playing.
Wow. That's really cool. I love it. Um, and this is my last question for you, but if we go on a tangent, that's fine too. But do you have any success stories that you'd like to share from like a student that got co-treatment either with you or like that you know of, anything that you'd like to share?
Yes. So one child that I've supported thrives on constant movement and deep
Mm,
sensory input. Without it, staying focused feels nearly impossible. So
mm,
during our co-treat sessions, my OT colleague provides sensory regulation through calming tools like brushes and swings and allowing me to target expressive and receptive language. Since
mm.
implementing this team approach, we've seen a dynamic improvement in his attention and engagement.
Wow.
And like I said, the therapies didn't just happen side by side. They complement each other in ways that
Right.
truly elevate his learning. And I absolutely adore that. Another child that we work with experiences low muscle tone, which makes
Mm,
sitting up or maintaining posture a real challenge.
right.
In co-treatment, one therapist gently supports his body. So my OT colleague, he supports his body and core stability, while the other, meaning me, leads the learning activity. This shared effort has opened a doorway to meaningful progress with physical support easing the strain on his body. The child has shown remarkable gains in expressive language, joint attention, and social engagement. Freed from the distractions of discomfort, he now initiates more interactions, sustains focus for longer periods, and participates with genuine curiosity. So, co treatment between speech and occupational therapy didn't just make therapy possible, it made learning joyful, purposeful, and deeply connected. These moments beautifully illustrate how collaborative care doesn't just divide tasks, it creates synergy. For many neurodivergent children, integrating therapeutic approaches make progress feel natural, joyful, and deeply personal.
Wow. That last story really like put stuff into perspective in a way that I sometimes I don't think people understand, right?
Yes.
to say someone who needs the physical support of being able
Hmm.
to like sit up well, to not be distracted by the way their body feels in order to learn, like that, I think really hits home um what a lot of these kids are experiencing, right? Like whether they need more sensory input or um kids with attention differences, like all of that is a way that you're essentially distracted by whatever's
Yep,
happening in your physical, that you cannot then
absolutely.
receive info. So that just like, I think that was the perfect way to kind of like hit that home and describe that feeling for people. I think anyone can understand like, oh, if I couldn't sit up super well, I would be distracted all the time.
Absolutely, right? Like,
Yeah,
just think about being at school. If we're not able to sit up and we need support with that, how are we able to sit at a desk and write and learn? It's very distracting. So, having
right.
that support from an occupational therapist while speech, we do what we do, it's just,
Right.
it's definitely a game changer. Otherwise, what you will see happen is speech will have to support him in his posture and try to get the learning done at the same time. And that's
Mhm.
extremely tough. So having both of
Right.
us there to target that together, it's a game changer, truly.
Wow. Oh, that is so great to hear. I really appreciate you, sharing your success stories and then also all of this like really helpful knowledge on what co-treatment is, why it can be beneficial, and how parents could maybe advocate for their kid to get those sessions, whether at the same practice or at different ones.
Absolutely.
Yeah. Well, thank you so much for being here. This has been awesome.
It has been a joy. Thank you so much for having me.
Absolutely. Thank you so much to the audience for listening. Make sure to subscribe and leave us a little rating and review. It helps other folks find the podcast, and we'll chat with you next time.